Hello and welcome to the September edition of the Academy of Online Radiology Education for the Cardiothoracic section. This is Dr. Scott Landreth from the Oregon Health and Science University in Portland, Oregon. Before we get all the way started, I would like to send a special thanks to Dr. Christina Foos and Dr. Prasad Pants for help editing this month's publication. Researchers from Harvard University and the University of Vienna sought to validate the exponential growth model for partially solid nodules and ground glass nodules in a cohort of patients with pathologically proven adenocarcinoma. Using their vast tissue database, the researchers identified 74 nodules out of a total of 750 adenocarcinomas, which met their inclusion-exclusion criteria of having CT scans from 3 different time points in 90 days and were either partially solid or ground glass nodules. Researchers split these 74 nodules into ground glass nodules and partially solid nodules. In this retrospective review, 2 blinded radiologists utilized a commercially available soft tissue kernel segmentation software to automatically segment the ground glass nodules and partially solid nodules to estimate baseline overlying volume and track nodule growth through at least 3 time points prior to resection. A linear mixed effect model was applied to simulate the data's mean and the variance and covariance of the volume growth curves. Using these data, the standard growth models were applied to simulate linear, exponential, quadratic, and power law models of growth. Analysis was performed by R2 and root mean square error, where the best fit model would have the highest R2 and the lowest RMSE. The exponential growth curve proved the best fit line in modeling the growth of both ground glass nodules and partially solid nodules. The utilization of sequential CT examinations allowed for growth velocities to be estimated for both, which revealed interesting associations with CT morphological, clinical, and histological characteristics. For instance, ground glass nodules were noted to grow at a faster rate than partially solid nodules, with the slope of the ground glass nodules being nearly twice that of the partially solid nodule. Doubling times for adenocarcinoma in situ was significantly longer than that of invasive adenocarcinoma, 939 days versus 679 days, respectively. Several other interesting associations were observed. The researchers did note that no one model of growth perfectly fit that of the tumors, which were interrogated. They offer a reasonable explanation in that tumors are innately heterogeneous and no two may grow exactly alike. Differences may be chalked up to differences in baseline aggressive features or the architectural growth pattern. As the exponential model does perform the best, the researchers propose that this model should be used to estimate tumor growth, with the caveat that due to inherent heterogeneity, small differences are to be expected, that one should use analogous features to get a more complete picture of how these adenocarcinomas are behaving in situ. The second article we'll review is entitled "The Timely Diagnosis and Treatment Shortens the Time to Resolution of Coronavirus Disease, Pneumonia, and Lowers the Highest and Last CT Scores from Sequential Chest CT." In this article, researchers from Wuhan, China, put forth an upgraded CT classification system for following patients infected with the novel coronavirus. It is widely known that the typical CT manifestations of COVID-19 are peripheral ground glass opacities. As the disease progresses, a cravey paving pattern appears amongst areas of ground glass opacity, which then progress to consolidation. This new system augments the standard CT classification system in order to account for these expected clinical changes by augmenting the score +1 for the presence of crazy paving and +2 for presence of consolidation, increasing the max lobar score from 5 to 7 and thus the total score from 25 to 35. Using this new system, in a retrospective review, a patient population of 30 COVID-19 patients were split into 2 different groups. Group A are those that were diagnosed and treated early, meaning less than or equal to 3 days after symptom onset, while Group B presented later than 3 days after first symptom onset. There were no statistical differences in sex or age between groups. Once split, Group A and B sequential CT scans underwent this modified scoring system. Time to disease resolution, max CT score, and last CT score were used as study endpoints. Sequential CT scores for each patient were interpolated, and time to disease resolution was estimated using the time point of the highest value on the curve. The variation tendencies of sequential CT scores for Group A and Group B were plotted using Lorentzian line shape fitting to the mean CT scores of each group. The last scores for Group A and B were analyzed using a Mann-Whitney test. Of the 25 patients enrolled into the study, 14 in Group A and 11 in Group B, early diagnosis and treatment was positively correlated to maximum CT score, time to disease resolution, and the last CT score. For patients in whom diagnosis and treatment was made in less than 3 days of symptom onset, patients had a statistically different, smaller max CT score, had a shorter time course to resolution of disease, and a smaller last CT score. These results indicate that early identification and treatment, even if this is just supportive care, is critical to limit the severity and longevity of this disease. By utilizing sequential CT scans and their novel scoring system, researchers were able to quantitatively and accurately describe the evolution of COVID pneumonia from gram-class opacities to gram-class opacities with craving paving to consolidation and validate that earlier diagnosis and treatment positively correlates with disease severity and time course to resolution. A study with increased power would be welcome to validate these findings in a larger cohort, as this study only included 30 patients. The third article to review is entitled A Comparative Study of Chest Computed Tomography Features in Younger and Older Adults with Coronavirus Disease. It was published in the Journal of Thoracic Imaging. Researchers from Hubei province performed a retrospective review of 72 hospitalized symptomatic adult patients with confirmed cases of COVID-19. These 72 patients were split into two groups, one which was classified as older adults, defined as adults aged greater than 60 years of age, and a group entitled younger adults, defined as adults younger than 60 years old. Fever and cough were the most common symptoms reported, with dyspnea and fatigue reported in similar numbers of patients in both groups. Chest CT examinations were reviewed and evaluated for distribution of disease, central versus peripheral, number of lobes involved, with the lingual included as its own discrete lobe for a total of 6 lobes, lesion density, either pure ground-glass opacities with a consolidation, or consolidative opacities, the presence of interstitial changes, noted as reticulations, interlobular septal thickening, or subpleural lines, accompanying radiological signs such as vacuolation, air bronchograms, or vascular engorgement, or pleural reactions such as pleural thickening or pleural traction. Although the power of the study is relatively small with a cohort of only 72 patients, the researchers observed the most common presenting features of symptomatic COVID-19 in adults. The older patient group were noted to have a statistically significant difference in lung involvement, with 68% of this group exhibiting involvement in all 6 lobes compared to only 37% of cases in the young patient group. Both groups exhibited similar lesion density with ground-glass opacities with mixed consolidation predominating in the majority of patients. The groups showed similar disease distribution with a peripheral predominant pattern noted in over 70% of cases. Older patients exhibited subpleural lines and pleural thickening on their CT scans at a much higher rate than their younger counterparts. These data suggest that findings of peripheral predominant mixed ground-glass and consolidated opacities as the most common presenting CT finding in symptomatic individuals is accurate. Older individuals routinely exhibited a more diffuse pattern of lung involvement when compared to the younger groups, potentially suggesting an explanation for the observed discrepancy in mortality and morbidity in this older patient population who are infected with COVID-19. The authors propose that the other statistically significant findings of pleural thickening and subpleural lines found in older patient populations may relate to differences in response to lung parenchymal inflammation in the older cohort and may be a marker of disease progression. Again, this study is low in power, and it would be interesting to see what this study would look like on a larger patient scale to validate these further findings. In our fourth and final article this month, we review an article entitled Incidental Coronary Artery Calcifications and Stroke Risk in Patients with Atrial Fibrillation, published in the American Journal of Röntgenology. Researchers from the University of Kentucky aimed to determine whether the presence of incidental coronary artery calcifications identified in patients with atrial fibrillation, or AFib, on routine chest CTs were associated with stroke independently of the CHADS-VASc risk assessment. It is postulated that coronary artery calcifications could be a surrogate for coronary artery disease in patients with AFib. 2 cohorts were established in this retrospective review: 203 patients who had a diagnosis of AFib and subsequent encounter for stroke, and 203 patients with AFib without stroke. Importantly, Each stroke case was one-to-one matched with a non-stroke case whereby the patients had identical risk factors, including similar age and similar CHA2DS2-VASc risk factors. Routine chest CTs were reviewed for both cohorts to ascertain the presence of incidental coronary artery calcifications. The extent of coronary calcifications were graded as none, mild, moderate, or severe. Coronary artery calcifications were identified in 129 patients with stroke and in 121 patients without stroke, with a p-value of 0.46. However, Cox regression analysis identified a significant temporal relationship between the presence of coronary artery calcifications and the likelihood of stroke, with a hazard ratio of 1.47. 124 of the 203 patients in the coronary artery calcification group died during follow-up, while only 60 of the patients without coronary artery calcifications died in the same time period, producing a hazard ratio of 1.6. The authors postulate that incidental coronary artery calcifications could be added to the CHA2DS2-VASc risk assessment tool, as they have demonstrated a moderate association with stroke and mortality. The limitations of the study are possible bias from retrospective review and mortality being affected from other confounding factors. As always, thank you once again for stopping by for this month's iteration of the Cardiothoracic section for the Academy of Online Radiology Education. This is Scott Landreth. Thank you. Good night.